This third group of drugs, fourth group of drugs are the Thiazolidediones. I don't think I said that right. Sometimes abbreviated TZDs. There's really two, pioglitazone and rosiglitazone. Rosiglitazone, you don't see that often. It's been kind of restricted. The prescribing guidelines has a kind of a black box warning that says there's a possible myocardial infarct risk, or at least an elevated myocardial infarct risk. So for some time it was actually pulled from the American market, and then it was reinstated with restrictions. And there's a few drugs that have that. And so really when we're talking about TZDs, we're really talking about pioglitazone under the brand name Actos. This drug binds to the peroxisome proliferator activator receptor, or the PHARM receptor, specifically the gamma subunit, which is found in fat and vascular cells. And what it does is it increases insulin sensitivity. There's also a mechanism where you can see a suppression of liver glucose production. And pioglitazone actually has the added benefit of altering cholesterol levels as well. So it'll actually reduce LDL and triglycerides, and it'll increase HDL. And so you can also see some immune targeting components as well. It affects interleukin-6, it affects a few pro-inflammatory cytokines, plasminogen activator, matrix metalloproteinases, C-reactive protein, and a couple of others. And so the target population, of course, would be patients that offer insulin resistance. And the primary glucose target is, of course, fasting. And so these are the sites of activity of your TZDs, the liver, the fat, and, of course, the muscle. And so from an efficacy standpoint, these drugs decrease plasma glucose by anywhere from 60 to 70 milligrams. And you can see reduction in A1C by about 1.5%. Like other drugs for hyperglycemia, you can see weight gain as one of the main adverse effects. There is also an edema component to this, so these drugs can cause edema, which is why there's a elevated myocardial infarct risk, especially in patients with kind of underlying heart disease. Patients that are treated with these drugs also have an increased risk of fractures. I don't know the mechanism, as well as ovulation can occur in patients that are kind of premenopausal and ovulatory. There's a rare hepatic dysfunctions, and of course these drugs are contraindicated in specific patients that have heart failures, and all patients with underlying heart disease and structural heart damage. Okay, and so you don't really see them used that often. They also, and another reason you don't see them used all that often is because they have what's called efficacy delay. And so this is literally a delay in which the drug has an effect. So in some cases, it takes up to 12 weeks for these drugs to produce any type of physiologic changes in the patient. And that's really just, frankly, too long for some of these patients. In terms of efficacy delay, we already kind of mentioned it when we talked about SSRIs. That when a patient first goes on an SSRI for depression, there's an efficacy delay there. It's not as long as the TZD drugs for diabetes. Efficacy delay for the depressed patients, typically 4 to 5, maybe 6 weeks. With the TZDs, you can also see liver dysfunction, and so you have to kind of monitor liver function tests. And so for these reasons, you don't really see these drugs used that often, which is unfortunate because they, especially pioglitazone, you really see nice reduction in LDL and increases in HDL, but the side effect profile and the lack of efficacy for such a long period of time really kind of warrants these drugs to kind of be on the back burner. And so from an advantages and disadvantages standpoint, TZDs often really don't produce hypoglycemia. When they finally produce a physiologic response, it is quite durable, and you see beneficial effects on cholesterol numbers. It just takes forever to get there. The other disadvantage is cost too. These drugs are kind of costly, and the adverse effects on weight, the production of edema, and exacerbation of heart failure, they really, the benefits don't really outweigh the risks. And so very few patients really take pioglitazone. And almost nobody in their right mind is going to write a prescription for pioglitazone unless there's literally nothing else you can do. But you won't really see it that often. So that's it for this class. There's only 2 drugs, and one of them isn't really used that often. And that's about it.